All right, if you're getting ready for the NCLEX, you know that feeling when an endocrine question pops up. It can feel like a lot. Today, we're going to zero in on two of the heaviest hitters, the thyroid and the pancreas. And think of this as your sneak peek into how we, at Exam Coaches, train you to think through these metabolic emergencies just like the board expects you to.
I really want you to let this one sink in for a second. The NCLEX is not trying to trip you up with some obscure hormone formula. No. It's testing one thing and one thing only. Can you tell when a patient's entire metabolic engine is either shutting down or completely spinning out of control? It all comes down to stability.
And that right there, that's what proves you're a safe nurse. Can you walk into a room and instantly spot the subtle signs of a crisis that's just starting to brew? Can you connect the dots? Because that's not just a test question. That is the very heart of good nursing. And that is what gets you a passing score.
It's a totally fair question, right? If it's all about recognizing patterns, why do these topics cause so much stress? Well, it's because without a really solid framework, all those signs and symptoms can just feel like a random, jumbled mess.
Sound familiar? It's just so easy to get the slow symptoms of hypothyroidism mixed up with the fast symptoms of hyperthyroidism. And even more dangerous is missing those early whispers of a full-blown thyroid storm or a Myxedema coma. The real trap is getting so focused on one little lab value that you miss the big picture, the life-threatening metabolic shift that's happening right in front of you. You are definitely not alone if you've fallen into this trap.
So here's the bottom line. Success on these questions isn't about having more flashcards. It's about having a mental framework that automatically sorts and prioritizes information based on what's going to harm your patient first. It's about thinking like a nurse who is obsessed with patient safety.
And this is what that looks like in the real world. Inside Exam Coaches, we don't just give you a laundry list of diseases, we organize them visually, like you see here, into a system that's built from the ground up around clinical priorities. This helps you build a mental map, so when you're in the exam, you see those connections instantly.
So let's put this framework into action, starting with the thyroid. The very first thing we have to nail down is the huge difference between a gland that's doing too little versus one that's doing way too much.
What's so cool about this slide is it lays out two completely opposite worlds. On the left, with hyperthyroidism, everything is grinding to a halt. Think lethargy, weight gain, a slow, sluggish heart rate, and that classic puffy face we call myxedema. Then you flip the coin to the right, hyperthyroidism, and the engine is redlining. Agitation, weight just melting off, a racing heart, and those protruding eyeballs, exophthalmos. Seeing them side by side like this, it makes the contrast just stick in your brain.
Okay, time to test the framework. You walk in and see this patient. Fatigue, bradycardia, facial edema. Your brain is screaming hypothyroidism. But what do you do first? What is the NCLEX looking for in this exact moment?
Your first mental filter is always safety. You know these symptoms could be pointing toward a myxedema coma, a life-threatening metabolic shutdown. So you immediately check their airway, you get a set of those slowing vitals, and you officially recognize the risk. Now, inside the platform, we'd walk through the entire intervention pathway, but for now, let's pivot.
Now, the complete opposite emergency walks through the door. Heart hammering, a high fever, they're severely agitated. The body is in overdrive. The framework needs to work just as fast here. What's your priority? Instantly, you apply the crisis recognition filter. You see this for what it is, a hypermetabolic state. You immediately assess for the classic signs of a thyroid storm, that high fever and the crazy fast heart rate. And because this patient could crash at any second, one of your top priorities is protecting that airway. This is just the beginning, of course, but you can already feel how the framework points you to your first, most critical moves.
Okay, let's switch gears. We've talked about the thyroid speed control. Now let's talk about the pancreas and its main job, managing glucose. For the NCLEX, this isn't about memorizing diet plans. It's about recognizing and managing severe glucose instability.
So the framework starts by giving you two very clear, separate paths to crisis. With type 1, the key is an absolute lack of insulin. The body has no choice but to burn fat for fuel, which creates ketones and puts them at super high risk for DKA. Type 2, on the other hand, is all about insulin resistance. The body is making some insulin, so it usually dodges DKA, but now it's at high risk for the extreme dehydration and sky-high glucose of HHS. Knowing which crisis to watch for is half the battle.
All right, a classic NCLEX setup. Type 1 diabetic. That fruity breath? That's the smell of ketones. Nausea.
and a glucose of 450. Your brain should be screaming DKA. The big question is, what is your number one, must-do first, life-saving priority?
The emergency filter for DKA is crystal clear, and the order is non-negotiable. And this is critical. Before you even think about insulin, you have to fix the profound dehydration. So, number one is aggressive IV fluids. Then you start to correct the wild electrolyte shifts. And only then do you start the insulin drip while checking that glucose like a hawk. It's a step-by-step process that stabilizes the entire system.
So we've looked at thyroid crises and pancreatic crises separately. But the real power, the magic of this framework, is how it ties them all together under one single powerful concept. First, you've got hypothyroidism. Remember, this is the slow state. The whole system is winding down, and the ultimate risk is a complete metabolic shutdown, a myxedema crisis. Your job is to spot that slowdown before it stops.
Then you've got hyperthyroidism. This is the fast state. The metabolic engine is redlining, and the risk is it'll burst into flames, a thyroid storm. Your job is to cool that engine before it completely overheats.
And finally, diabetes. This is all about unstable fuel, glucose, which can cause these life-threatening dehydration and acid-base emergencies like DKA. So you see, whether it's slow, fast, or unstable, it's all about recognizing and managing metabolic instability.
And this really gets to the heart of what we're all about. We don't just teach you facts about endocrine disorders.
We train your clinical judgment. We train you to spot a crisis before it explodes. We train you to know exactly which intervention to pick first when the pressure is on. We train you to assess for that core concept of metabolic stability in every single patient you see.
And why does that matter so much? Because that's what the NCLEX is all about. It's not just about being correct, it's about being safe and timely. The highest scoring answer is always the one that best protects the patient in that specific moment.
What you've just seen here, this is just a quick preview. The full comprehensive thyroid and pancreatic framework with all the interventions, the medication details, the deep dive rationales, it's all waiting for you right inside the Exam Coach's platform.